All right, folks, we're going to go ahead and start with some housekeeping items and get rolling here since there are hundreds of you already on the call. We do have a few hundred more who actually registered for this, so we're going to give them a little bit more time to funnel in, but we'll take care of some housekeeping items as we are getting started here so that we can roll right into why you're here today and not keep you all day for a Medicare session. We know this is not the most exciting topic in the world, so we do want to make this certainly worth your while. Get into the details. We'll definitely make sure you walk away from this fully educated on Medicare 101, but not take all day and put you to sleep in the process. So while these folks are funneling in, a couple housekeeping items. Again, number one, if you're a note taker, grab a pen and some paper. We recommend that for everybody. There's a lot of information to get through. We do not expect you to remember all of it. So the notepad will definitely be of help to you. At any point during the call, there is a calendar on the screen. And you can click in there to secure some time with our team to have your own personal appointment to discuss your situation and get your questions answered. Because no matter what we talk about here today, which it all applies to pretty much everybody, there are specifics to your situation that are not going to be covered here. And we want to offer that one-on-one consultation. It's a no cost or obligation conversation with a licensed insurance professional to help you and guide you along with your Medicare journey. So click that calendar at any point. Maybe you have to hop off early, you're still working, you need to go back, leave lunch and go back to work, whatever it may be. Go ahead and book that appointment when you are ready just by clicking on that calendar on the screen. So a couple other things while we are here, we are going to focus today again on Medicare. If you came here to learn about under 65 healthcare, if you came here to learn about home and auto, this is not an insurance for all conversation. This is really for those of you who are turning 65 or looking at retirement and how to handle your healthcare when you go into retirement. And this is something we do every day. So like I said, we have hundreds of people registered today. We speak to thousands and tens of thousands of people year round across the country to bring this kind of education to you. So we do take this seriously. We want to make sure this is a good use of your time and you get everything you came for here today. So as we get rolling here, why don't I go ahead and pull up my screen and we will get into the presentation here. Bear with me just a moment. All right, so I have no way of knowing if you can see that, but I'm pretty sure that you do. I think we've all become decently accustomed to using things like Zoom since 2020. So anyway, this is our Medicare 101 for 2026. My name is Kevin Shaken. I'm your host today, and we're going to go through a couple quick things about our agency and what we're here to help you with, and then we're going to dive into why you're here, and that is ultimately to learn these Medicare 101 topics or Medicare ABC. So again, I'm Kevin. Most importantly, my job is as a husband and a father, even though I am the owner of my agency, the Insurance Masterminds Agency. Number one job every day is for those people pictured here, my two sons, my daughter, and my wife. And this is who I get up for every day to make sure we can, be living the life that we want and support them. And I also do this for my family, my parents' generation. Those of you who are here today, you are part of that generation. And, my parents and that generation, your generation has done so much for me. This was an opportunity that I discovered about 5, 6, 7 years ago that allowed me to not only build my own business, but also give back to that generation that's provided so much to me. Um, and again, I'm a Medicare and retirement expert. I'm not a home and auto expert where we're going to talk about home and auto insurance. I'm not an under 65 health expert. So I'm not an Obamacare Affordable Care Act expert. We are focused on Medicare health insurance and retirement. I am the author of Medicare Breakdown. So this is a book that you will all be able to get a copy of just for attending here today. Whether you need our services or not, it's a great resource that goes a little bit deeper into some of the topics that we will cover today. So I did author that book. And also, ultimately every day I come to whether it's approaching my family or my business, kids basketball teams as a coach and a leader and a teacher. And that's what we're here to do today because we look at our business. Number one, yes, we are an insurance agency, but we are an educational platform that prides ourselves on bringing real education to you to help you make the decisions that are best suited for your situation with a little bit of assistance from us. So again, the Insurance Masterminds, that's our agency. We have over now 165-star reviews. At least that's, what the presentation says. As the year goes on, this number continues to grow. But we are, 5-star rated still on Google, with over 160 reviews, covering all over the United States. We do some things in person for our local community, but most of these learning opportunities and conversations are done digitally online over the phone, and across the country. And you can also find us and follow us on pretty much any social media channel. That QR code should take you to a page where you could follow us. And not that we need, the following, but again, educational topics. If you truly are interested in learning more, maybe not watching a 30-minute webinar, but just finding a 1 minute, 2 minute video about a certain Medicare topic, you can find that online through our social media pages. And ultimately, a huge portion of my business first starting out was helping friends and family. And so my philosophy and what I teach to my team is that we treat our clients all like we're helping our family with their Medicare. How would we handle our parents, our uncles and aunts, our cousins, our grandparents, right? So that's how we roll. All right, so moving right along. Again, if you have that pen and piece of paper, please make sure you are writing things down. We're going to try to move at a steady, not too quick, but a steady pace. So a lot of information to gather here. And again, there's always going to be the opportunity for questions later, and you will have that option at any point, because you'll have questions of your own, to book an appointment with our team. Again, no cost or obligation, to just get these questions answered that pertain to your specific situation. Okay, so let's start here with original Medicare. Okay, we're the ABCs, the very foundation that affects pretty much everybody. And that's parts A and B. So part A is your hospital coverage. Think of that as your inpatient care. And part B is your doctor's coverage, or your medical, as it will say on your Medicare card. That's more of your outpatient care, your day to day. Now, there is no monthly premium for part A for the vast majority of people. If you qualify for Social Security benefits, either through your own work history or your spouse, you will also qualify for premium-free Part A hospital coverage. Now, Part B in 2026 has a premium of $202.90. That is what the vast majority of Americans will pay, is that 202.90. So that probably applies to the majority of you on this call. If you are in a Medicaid, like a lower income situation, you may pay less. And if you're a higher income earner, you may pay more. And again, these are things we can talk to you about one-on-one as it pertains to you, but the majority of you will pay 202.90, or at least 202.90, even those higher income earners. Now, how do you enroll, right? That's always a big question, is how do we actually get onto Medicare? And it's not all automatic, by the way. So don't assume, number one, that you have to get Medicare when you turn 65, or that it happens automatically. Now, if you're receiving Social Security benefits before you turn 65, you will be automatically enrolled in Medicare A and B. And you will have to decline Part B if, let's say, you're still working, or you have a spouse working, and you want to keep that employer coverage and you don't want Part B. But by default, you will be automatically enrolled. Scenario number two, which is quite a lot of you, I'm sure, is you're not receiving Social Security benefits yet, because either you're still working or you're not at full retirement age yet, and you've decided to push that back a little bit. And that does not happen automatically. And then number three, you're still working and covered by your employer plan. So how do we get enrolled? Now, number one, I already told you, if you're on if you're on Social Security already before the age of 65, you're automatically enrolled into Medicare. And then if you do, you need A and B because you don't have other coverage, then Part B will start the first month of your birth month, and you will have that $202.90 taken out every month, from your Social Security. You'll receive your Medicare card roughly 3 months prior to your birth month and your start of Medicare, but the deductions will start the month you turn 65, which is the month that your Medicare will begin. For those of you who are not receiving Social Security, but maybe you're retired or you just don't have an employer plan, okay, then you have to enroll online. So this is going to affect those of you who, let's say, work for a smaller employer where your coverage is not considered qualified or creditable, and would not be seen as the primary coverage. Medicare would be required there. Maybe you have an individual policy because your employer doesn't provide one, or you're self-employed, whatever the case may be. ACA, Affordable Care Act, policies are not considered qualified plans. So once you turn 65, you have to go into Medicare. So whatever the reason is, you have to do this manually. Now, we recommend going online. We have a very helpful video for you about how to enroll in Medicare online. that we can always send if you need some assistance. But you would go online as your number one priority. And if you're on this call, you're probably pretty apt online and with technology to the point where you could apply in 10 to 15 minutes. If you prefer to do things differently, you can call, get an appointment over the phone. You can go in person or try to get an appointment in person at your local Social Security office. That does vary by location, by the way. And you can also mail in an application. Now, if this is you, Medicare Part B is not going to be automatically paid now, right? And there's no Social Security. So they're going to bill you quarterly, 3 months at a time. In 2026 here for 3 months, that's $608.70 per month. You can either opt to receive that bill and pay it every 3 months manually, or you can set up, once you're approved for Part B, you can set up automatic payments from your bank account, which will happen monthly. So this way you're not writing a check for 3 months at a time at a much larger amount, and it's just happening automatically on a monthly basis out of a checking or savings account. And then finally, original Medicare enrollment scenario number three, you're still working and covered by your employer plan. Now, you can either enroll in Medicare or you can delay Medicare. And I mentioned employer size. So 20 employees or more, generally you can keep your employer coverage. And maybe you're doing that because you have to cover a younger spouse. Certainly is not a universal decision or universally accurate that all employer coverage is better than Medicare. That is absolutely not true. Oftentimes we find that employer coverage is not as good as Medicare. Maybe it costs less, but much higher exposure. Other times it's great, right? So that's a case, again, case by case. You talk to one of our experts on this about, how do you compare these things will help you understand your options. But sometimes you just don't have a choice because you want to cover or need to cover that younger spouse. And oftentimes you can continue your employer coverage. Maybe you just get Part A only, although there are exceptions to that rule as well, which we'll talk to you about one-on-one. But you don't have to go on Medicare if you've got that qualified coverage. But in this case, again, you're still working and covered by employer plan. You could go on Medicare, or you can delay it without penalty, by the way. Okay, so I want you to understand, just because you turn 65 and you have an employer plan, maybe you have 500 employees there or 50 employees there, and you like the coverage, you have to cover your spouse, you don't have to go on Medicare, and you won't be penalized for that either. Um, Now, when does Medicare begin? Medicare begins the first day of your birthday month. So I'm an April, mid-April birthday, meaning when I get to that age, my Medicare will begin on April 1st, April 1st. Okay. Now, if I was born on April 1st, my coverage would actually begin on March 1st. So if you're born on the first of the month, everything moves up a month. Otherwise, you're going to have coverage beginning, even if you're born on the 31st, March 31st, your coverage will begin March 1st. So let's talk about major exposures, why we are here, and what do we look at for clients? It's not just to make sure you're educated, and that's a huge part of this. What are the ABCs? What are the costs? But what are the exposures, right? We're not just looking at this as let's help you get onto Medicare, find a plan, and hopefully it works well for you for the next 20 or 30 years. We want to cover you so that financially you are reducing your risk, you're protecting your assets, and you are getting the health insurance and the health coverage and care that you prefer given the options that are available to you. So let's talk about those major exposures. Now, number one on Part A, the hospital coverage. You might, of course, have no premium, but there are out-of-pocket costs. So every hospital stay, essentially, every benefit period in the hospital is a deductible of $1,736. So that's not an annual. That can happen multiple times a year. And on Part B, you have a few things that you're exposed to. Number one is the deductible, which is pretty minimal. It's a calendar year deductible, so $283 annually, but then 20% coinsurance with no limit. And that's what gets scary and a little bit different, right? You have an employer plan now that has a max out of pocket, right? Maybe it's $5,000. So it's a lot of money, but you say, I can afford that. I reach 5,000 and now I pay zero the rest of the year. On original Medicare, there is no max out of pocket on parts A and B, and we will talk about that exposure and, of course, how to reduce your exposure. There's also Part B excess. Okay, so this is not a super common charge to face, but you could pay an additional 15% above what Medicare would charge or allow if you're charged Part B excess. So these are things, of course, again, that we want to protect you from. Now, some things actually aren't even listed here. I apologize, but on the hospital side, again, there are copays for long-term hospital stays, over $400 and over $800 a day, depending on how long you're in there. There are skilled nursing states, which we'll show here in a moment. But again, there's a lot of exposure, and our job is to make sure you get enrolled properly, you choose the right plan that we'll talk about here, and you have the right coverage overall to protect you from all potential exposures. Now, this is what I refer to as Medicare's big decision, because this is the first big decision you have to make, which is Medicare supplement versus Medicare Advantage. And in some cases, you don't have an option in the future to make a change from one to the other. So you have to understand your rights when you do make this change, or when you do make this decision, rather. And again, this is the fork in the road, and you got to choose one. And this is the biggest decision you will make when you first start getting onto Medicare. So, what are your choices, right? I mentioned a fork in the road. I love whoever created this illustration because it is exactly what the analogy I've always used of a fork in the road. It really gives that to us here. So you have A and B, right? And you're going to have A and B no matter what choice you make here. So that $202.90 for Part B, that Medicare card with A and B, you're going to have those as a, just a uh, constant no matter whether you choose supplement or Medicare Advantage. Now, on the original Medicare side of the screen here, you've got Medicare supplement, or what's in parentheses Medigap, and a Part D prescription drug coverage, right? So Medicare supplement is there to provide you coverage on those things that we showed you previously about hospital deductibles, 20% co-insurance, 15% excess, right? So that you now, instead of having no cap on medical expenses, you now have protection from those limitless out-of-pocket costs. And then Part D is your prescription coverage, which is one of the letters in the alphabet soup, but it's not provided by the government, so that's added as a separate policy. Or you can go Medicare Advantage, which is Part C. I like that it says here combines. I like to think of Part C as standing for combining your coverage. So it gives you all the benefits of A and B. Again, you're still enrolled and paying the government, but the insurance company combines your hospital and medical benefits into one plan that may also include things like drug coverage and additional things that Medicare may not cover that we'll get into in a little bit. But that drug coverage is typically combined, so A, B, and D all is part of wrapped up in that Part C plan. Now let's compare these two options so we start to understand the pros and the cons. And there's no perfect scenario, right? With insurance, you want it to be there in case you need it, not lack it when you do need it, and not have it, right? So, but there's not a perfect scenario, right? So you got to figure out which one is best for you. So starting with Medicare supplement, price-wise, you're going to have a Part B premium. We know that you're going to pay that really regardless of which option you choose here. Plus, you will pay a premium for your supplement plan. That is always going to have a premium. I don't know what it is today. We'll give you some idea of numbers while we're here, but it is dependent on things like where you live. And you all here, and hundreds of you, you could live in all 50 states for all I know, right? Where do you live? What's your age? What's your gender? Do you qualify for any type of household discount? What company do you use? What plan, what Medigap plan do you choose? So that premium does vary, but you will pay a premium for the supplement as well as the Part B premium. Coverage, this provides you the lowest out-of-pocket costs. So this is the most predictable from a cost standpoint, right? You can know almost to the dollar what your out-of-pocket costs will be when it comes to Medicare approved services for the year. Okay, so lowest out-of-pocket cost for Medicare by far with Medicare supplement. From a network standpoint, it also provides you access to any doctor in the country that's contracted with Medicare. There is no network and there are no referrals needed. So whether you might live in Georgia, but you need to go to the Mayo Clinic in Florida, or you live in Virginia and you're going to Cleveland Clinic, whatever it is, right? That those places take Medicare. It's going to work the same way at home as it does anywhere else in the country. No referrals needed. And then finally, Part D, that prescription side of this, you do have to obtain from a standalone plan because the government won't provide it. It's not going to be a part of your Medicare supplement. Now we look on the other side here, for Medicare Advantage. You still have your Part B premium. Okay, expect you're paying that to the government still, plus an Advantage plan premium. Now I will say, and we'll dive into this a little bit deeper, you will see $0 plans advertised. That is very real. That is typically always going to be referencing Medicare Advantage plans. So it's possible the Advantage plan itself has no additional premium. But as we get into cover and exposures, we should not expect to pay zero on top of 202.90. And again, this depends on where you live and what plans are available. So again, it's unknown for that reason. But this is why when you at any point want to click on that calendar to find out your specific options and get your questions answered, we'll be able to give you exact numbers, Medicare roadmap and cost summary for exactly your situation and what you want to achieve. Coverage wise, this is where you will typically then see lower fixed costs on a monthly basis with higher out-of-pocket costs when you use it. Now, because it's based on utilization, I can't tell you that your cost will be higher because you might not go to the doctor much and you might have a very good year health-wise and pay nothing out of pocket because you didn't use your benefits. But the potential costs are higher. So when you use them, costs are higher than the Medicare supplement. Network wise, these are much like whatever you have now, whether you have an employer plan or your spouse's employer plan, you have a union plan, you've got an ACA, like an individual or family plan, right? These are all managed care plans with a network. I don't care what the plan is, even if you say you can go to any doctor, that's a PPO, that's still a network-based plan. And you are always best served in the network in terms of ease of access to providers if they're in the network versus out, and your cost being lower in the network compared to out. So there is a network, right? Doesn't mean you don't have plenty of doctors available. Just be aware that this is more similar to what you have today. Now, Part D, that drug coverage is typically included in the Advantage plan. So you don't usually have to go out and shop for separate drug coverage, but it's something we would consider as we go through the best plans for you is making sure not just the doctor network is right, but hey, we've got to cover those medications properly too. Excuse me. And then these plans will typically, or they can come with additional benefits. So I mentioned earlier, I referred to these as things that Medicare does not cover. So Medicare does not cover dental. Medicare does not cover glasses or hearing aids, right? Those kind of things, or over-the-counter or gym membership benefits can be included in a Medicare Advantage plan. Again, the amounts are not standard. These are options that the insurance companies can provide to you. So they're not standard, plan to plan. So when you compare these two options, how I would very simply define this, or compare these. On the left, you have more of a more provider choice, higher fixed cost, more predictable overall cost. Okay, on the Medicare supplement. On the Medicare Advantage side, you're going to have lower fixed cost, considerably higher potential out-of-pocket cost, a little bit more restriction on the provider choice because of that there is a network, okay, but also a more benefit-rich plan, okay. So when you're looking at these two, understand now, I do want to point out here as we're on, oops, let's go backwards on this slide. I talked earlier about you can't just go back and forth. And again, where you live depends a little bit, but the vast majority of you are not in states where you can just flip-flop, okay? So Medicare supplement plans, these are guaranteed policies to you at age 65, or if you delay Medicare Part B when it's guaranteed to you when you start Medicare Part B, and that could be 10 years, you can be 75 years old, but you're new to Medicare Part B, you can get that Medicare supplement, no questions asked. Medicare Advantage is always available to you as long as you have Medicare A and B in a valid enrollment period, whether it's 65, you retire at 67, you wait until open enrollment in 3 years. Medicare Advantage plans have to accept you no matter what. The supplement is only at 65 or new to Part B in certain special circumstances that you cannot really predict or plan for. So understand that you can go from a supplement to an Advantage plan, no problem. No worries about underwriting or health approvals. From Advantage to supplement, it's not so easy. Now, you may never see the need or want to do that, but understand you can't just pick up and move from an Advantage plan to a supplement because all of a sudden you decided based on your health and now your rising costs that it's the right plan for you and you'll just change because those supplement plans are private secondary insurance plans and they will require underwriting in most cases and those companies can deny you. So just be aware of that as you are making this decision. Again, that's one of the biggest reasons I call it the big decision when it comes to Medicare. Now, we talked about our job being to reduce exposure, okay? Make sure that you have all that you need to protect your assets, be covered for the things that life throws at you. So cancer and then heart attack or stroke coverage, these are two separate types of policies. We recommend cancer coverage for every Medicare beneficiary, okay? Whether it's in your family history or not. Unfortunately, it's a very prevalent diagnosis these days. Everyone either has had it, has a family member, or knows somebody with cancer. So we certainly don't wish that on anybody. But because it is so prevalent and there is a high likelihood of having out-of-pocket expenses if diagnosed with cancer that Medicare may not cover, then we always recommend this to you. And amounts, would vary per your diagnosis and treatment path and whether your costs are associated with medical or prescription or non-medical, right? There are out-of-pocket costs associated with those diagnoses. Skilled nursing coverage, another thing to be aware of when it comes to Medicare. Now, if you're on original Medicare, you are not going to, and that would be with a supplement, right? It would be ideally that you're set up. Days 1 through 20, you're going to pay zero. If you're on a Medicare Advantage plan, you might pay zero, or you might have a copay, and that is plan dependent, but usually the first 20 days, pretty low to no copay on an Advantage plan as well. It's also assuming it's in network. But then days 21 through 100, $217 a day. Now, if you don't have a supplement, that 217 is out of your pocket. If you do have a supplement, it's going to be covered. If you're on a Medicare Advantage plan, that 217 or some number close to it is likely to be out of your pocket as well, unless again you are covering yourself by proper means. Now, after day 100, you are responsible for all costs. I don't care if you're on original Medicare, the supplement, or a Medicare Advantage plan. Neither one of those is paying for any skilled nursing coverage after day 100. Okay. Now, that note at the bottom, your doctor or healthcare provider may recommend you get services more often than Medicare covers, or they may recommend services that Medicare doesn't cover. And if that happens, you pay some or all of the costs. So it's always good to ask questions to your doctor, but as we start talking about how to properly protect you, understand that, yes, while many things are covered by Medicare, that doesn't mean everything's covered. So just because they say 100% coverage days 1 through 100 on skilled nursing doesn't mean you're always 100% covered. Okay, if you look in the Medicare New Handbook, which this is a long, relatively boring read, I get it, but good to read through. This 2026 book is out. It's also understanding not just doctors recommending things more often than Medicare would approve, but we talk about skilled nursing and hospitalization. Are you an inpatient or an outpatient? Sometimes you're in the hospital, but you're in under observation, right? And so you actually have to be, if you see near the bottom for skilled nursing, Medicare only covers that skilled nursing stay after a 3-day minimum medically necessary inpatient stay. So that means you're not just in the hospital for 3 days, but you are admitted as an inpatient for 3 days, excluding the day of discharge, right? If not, Medicare is not going to approve that, right? So this is where, as we start talking about covering you properly, we get into umbrella coverage options to eliminate these major exposures. And I'm not talking about covering you for every little doctor's visit that you may have or an urgent care visit or going to a lab. We're talking about major catastrophic exposures here, right? So no matter what umbrella coverage you choose, umbrella 1, 2, or 3, your foundation is going to be your Medicare plan with prescription coverage. So that's either a Medicare supplement and a standalone Part D plan, or it is a Medicare Advantage plan that includes the prescription coverage. But as we've discussed here, we want to make sure we do recommend cancer for all Medicare beneficiaries, which is why you see that starting out with umbrella 1 and all the way across the board. All right. Considering what your options are and what plans you choose, you may want or need dental, vision, and hearing or hospital protection. And then, as we just discovered on the last screen with recovery or skilled nursing, there are certain things related to skilled nursing stays and home health care that will leave you without a pocket exposure on Medicare if you don't approach or address those properly. And that's where recovery care comes in there on that umbrella number 3. So, and skilled nursing, unfortunately, is the biggest exposure. Like it's again, it can be $0 for you, right? We just discovered that as we talked about 100 days covered, but it's also zero coverage on day 101. Sorry about that. Where did I go? Smooth. I'm smooth. That's what I like to be known for. All right, let's turn that video back on. There we go. All right. So, apologies. So anyway, recovery or skilled nursing is the largest exposure because when we talk about days 101 plus, there's no coverage from any Medicare plan. But again, we'll talk to you about that one-on-one, how to make sure that you are properly covered. So let's dive a little deeper. Option number one, if you go on a Medicare supplement, we're talking about that hospital deductible of 1736 each time, $283 deductible, calendar year deductible, it's one time, 20% coinsurance with no limit, and a 15% Part B excess charge, or yeah, Part B excess. So again, if you go with option one, you have the red, white, and blue card for A and B. You've got a Medicare supplement card or a Medigap card. So this is a private health insurance plan. It covers some or most of the original Medicare out-of-pocket expenses. So this is specific to Medicare approved services. So don't misinterpret this as, again, this picks up whatever Medicare doesn't cover. If Medicare doesn't approve something, the supplement doesn't pay anything. If Medicare approves it, the Medicare supplement will pay what it's required by law to pay. So deductibles, co-insurance, copays. Okay. And then again, you have a separate card for prescription drugs, which is for another private insurance company with prescription coverage, something you would take to the pharmacy whenever you need to fill those prescriptions. Just kind of went over that. So here are those supplement plans. Now, you're going to hear us talk about Plan G there in the middle and Plan N on the far right. If you've done any research, you have friends who are already on Medicare, you may have heard about Plan F or C. Those are not plans you should concern yourself with. If you're on this call, you are likely not qualified for those plans because they have been grandfathered in or out, however you want to look at that. So G and N are your most comprehensive option. But here's a look at what is out there. And you can see, there's a lot of 100% there. So when we talk about making things predictable for you, again, this doesn't cover what Medicare doesn't approve, but for anything Medicare approves, that could be a hospitalization, a skilled nursing stay, a surgery, chemotherapy, radiation, cardiac rehab, whatever it may be, a lot of things will be now 100% covered. Part B deductible, you're going to pay that, but that's again $283 in 2026. It's not a huge deal compared to what you probably have today on some higher deductible plan. And there's even foreign travel emergency coverage, which is a nice little add-on. You may choose to if you travel internationally, to purchase some additional insurance, but there is something there. So again, very good coverage on GNN with very minimal out-of-pocket costs and copays. So again, going back to the skilled nursing side of things, if you are in a Medicare approved skilled nursing stay, if you were down there where it says skilled nursing facility care coinsurance, Plan G is 100%, Plan N is 100%, right? And the Part A deductible, which is right below that, 100%, 100%. Okay, but as a reminder, that's assuming it's an approved stay, so minimum 3-day inpatient hospital stay, and for days 1 through 100. It does not add anything beyond day 100. And I'm sorry that I am beating a dead horse here, but it's very important to understand that there is no coverage from any Medicare or Medigap option after day 100, or if Medicare doesn't approve it. So let's talk about the supplement. What's the cost of Plan G? Now, I told you earlier it is dependent on many factors, but generally speaking, the average rate for Plan G, and assuming many or most of you are turning 65 or a few years beyond that, perhaps, 100 to 200 a month. And it's a $100 range. I apologize, but it depends on where you live, right? In some states, you're going to pay significantly higher costs than others, but generally 100 to 200. Could be a little bit more or less depending on where you live and what your situation is. Now, what supplement plan is the best? You heard me talk about Medicare Supplement Plan G and Plan N. So these are your top two plans. G, if you want to say the best, that's your Cadillac, if you will, because it has the least out-of-pocket cost. So the only thing you pay for on Plan G for Medicare approved services is the deductible for Part B, which is only $283. That should say calendar year 2026, but that's the only Medicare approved expense that you will have. Everything else Medicare says yes to, you pay zero for it. Plan N is going to cost you roughly $20 to $40 less, again, give or take depending on where you live, but $20 to $40 less than Plan G. As you can see, you will also pay additional copays. So you will pay a $20 copay for a doctor's visit, a $50 copay for an emergency room visit if you're not admitted to the hospital after the emergency room. Those are the only copays. And then the other thing, which is Part B excess, it's very rare that you will run into this, but that's an excess charge potential that Plan G would have covered. Plan N does not. So this is where you go to a doctor who takes Medicare patients, but they don't agree to Medicare's fee schedule, which again is very rare. They can balance bill you this excess charge of 15%, which you would then be responsible for. Now, key points about these Medicare supplements. The best time to enroll is 6 months prior to your birthday month. So again, I'm an April birthday. When I look to do this down the road, I should be looking to sign up sometime maybe October. And again, that is company dependent, so you can't always do that. The reason we would tell you this is number one, it's great to get things checked off your list, first of all. There's a lot of things you have to do as you prepare for Medicare. Get checks off your list and avoids mistakes, so you're not doing anything last minute or incorrectly. But also, whatever the rate is 6 months in advance, if you can apply that early, you will lock that in. So that's the rate when your plan starts. And most companies will honor that for the first year that you're on it. So it really locks it in from 18 months from the time you actually sign up. Because these rates will go up over time, right? We're not going to tell you every company and every Medigap plan, you will have rate increases over time, but you can lock that in early. Because if you wait maybe and then it's January and you sign up for an April start date, maybe they've had that new year rate adjustment and now you're paying a little bit higher rate. Medigap plans are standardized. So please understand if you have some allegiance to an insurance company, which I know is rare, I'm not suggesting you should, but you may have a really good experience with an insurance company that you like and you want to use their supplement. I can promise you, they are not providing you anything from a medical benefit or an access to care standpoint more than any other company because by law they are standardized, federally regulated. Meaning whatever I just described you on the previous slide about what you pay out of pocket is exactly the same from company to company. All Plan G. So Plan G is Plan G is Plan G. Plan N is Plan N is Plan N. Same with your access to doctors because your doctor will bill Medicare, not the supplement plan. So you'll see some companies that we list here at some point. I think maybe, yeah, right here. Some you've heard of, some you never have, right? We'll help you figure out which one. Point is, I don't have any allegiance to any insurance company. We want to do what's right for you as the client, get you the best coverage at the lowest cost, cover you comprehensively and cost effectively for the rest of your life. And you may never have heard of a company before that's recommended, but based on where you live, they have maybe the best or most competitive rates, stable rates. They're going to cover you the same as every company on there that you've heard of. So this is just a list of some of the companies we represent specifically on the Medicare supplement side. Like I said, we work for you, not the insurance company. Okay, so whatever you want to go with, ultimately, we will work with you on. We just want to make sure you have a formal recommendation based on our expertise and what you convey to us as your wants and needs. Now, let's talk about some myths with Medicare insurance brokers. Well, number one, we hear this, I must have to pay a fee to use a broker and get their help with all this. And sometimes some of you reach out and say, how can I reimburse you for your time? I didn't even purchase insurance from you, but I really want to pay you for your time. Can't accept that from you. We don't charge any fees of any kind for our services. So even if you don't use our services, we're not going to send you a bill. But there is no fee to use a broker, whether it's us or anybody else. If someone is placing your insurance and collecting a commission and they're charging you a fee, that's illegal. So just be aware. Myth number two, nobody works for free. So the insurance company must charge a higher price if I go through a broker like you. Absolutely, we don't work for free. I would not work for free. As much as I love doing what I do have, as you saw earlier, I have a family to support and a lifestyle to support. And I like building a business and being paid for my time and expertise. So you're right. I don't work for free. My team does not work for free. However, you don't pay anything extra for using a broker. Again, anybody that would charge you more to use their services and collects a commission, that's illegal. So whether if the $100 plan that you want from ABC Insurance Company is $100 through them, it'll be $100 through us. You'll pay the exact same price whether you use our help throughout this process or not. You do it alone, you go to a different broker, you use our services. Insurance companies pay us directly for educating you, first of all, and helping you to enroll and providing lifetime service on those policies. But again, you're not going to save money or lose money based on how you go about getting your plan. And myth number three, if you get paid by the insurance companies, you must have a bias towards one company or the next. Truth is, we have access to over 24 companies. We get paid by whoever you choose to do business with. If we are able to help you with it, they will pay us. So we're not really biased towards any company over another. Sometimes it's because you live in an area where this company has better and more stable rates or a better history, right? A lot of times when you're talking about Medicare Advantage and Part D, those compensations or those commissions are federally regulated. They don't really vary anyway from company to company, okay? And it's not going to really make a difference, right? So again, we don't look at that. We are working for you, and we know that if you are going to work with us long term, which is what makes this a profitable relationship for our business, then you need to be happy with your coverage. And our goal is to not only educate you and initiate your enrollment, but is to provide you a lifetime service. This is a lifetime relationship between you and my agency and my agents. And we take that very seriously and we really appreciate the opportunity. So again, no fees, price is what it is, and we are completely independent of the insurance companies. Thank goodness. Prescription drug coverage will wrap up very soon here. So again, original Medicare A and B plus a supplement. You get drug coverage as a separate standalone plan. That's the card you will take to the pharmacy. Now, if you don't enroll in Part D on time because you don't have creditable coverage, and again, most employer coverage is creditable, so don't worry about this, but there could be late enrollment penalties, and I referenced them earlier with Part B, but also on Part D, you would face them. Okay, don't think because you're turning 65, you have to get drug coverage from Medicare. Just understand this is more so. I tell you, the more common thing we've run across is you're on little to no medications. Your medications cost zero or almost zero. So why do I need a Medicare Part D premium to pay if I don't need the plan? I'll pick it up when I need it. Well, number one, you can't just pick it up any time a year. At that point, it'll be once a year. And number two, these penalties accumulate as you should have had coverage and they don't go away. Unfortunately, they are lifetime penalties. If it was just a year, you paid a penalty or you paid a certain amount back and then moved on, then yeah, maybe you'd make that decision. But these are lifetime penalties. Now, our process is to help you by inputting your drug list into Medicare.gov, understand your pharmacy preferences, compare all options available in your zip code, and then recommend the plan of your choice. And that plan, whether we work with it or not, we're going to direct you to it. A lot of Part D plans as of 2026 are not even working with brokers, but our commitment to our clients is to go the extra mile and provide this service, even if it's a non-commissionable product or process for us. Because our goal is to make sure your entire umbrella coverage is appropriate for your needs and to reduce exposure and provide, again, what fits your specific needs. This is unlike anything you've had before, like with a group plan where everyone has the same plan, right? This is your opportunity to get very individualized custom coverage. So make sure you get enrolled in the plan of your choice and then reevaluate that every year, October 15th to December 7th, to make sure that drug coverage is still best. Or if you're in a Medicare Advantage plan, that the drug coverage that's part of that plan is still best for you the following year. So just as a recap, again, your original Medicare, you have Part A and B. Part B is 202.90 a month. Medicare supplement, $100 to $200 a month likely. Varies by zip code, age, gender, etc. Prescription drug coverage, again, that is also going to be dependent on the plan you choose. Could be as low as zero or over $100. Just depends on what's best for you. So that's original Medicare. And this is your core product. So as you look at the umbrella illustrations, and we'll show that one more time, this is going to be your uh, core coverage on all three umbrella packages, right? On the Medicare Advantage side, okay, again, you're going to have it's a managed care plan, including parts A and B and drug coverage typically. Now, I mentioned plans can be as low as zero per month. You still have to pay your Part B premium. You're not getting out of that because you have a $0 plan. And that is going to provide coverage for hospital and medical. You will have copays and potentially deductibles, co-insurance, and an out-of-pocket maximum. Um, and because the out-of-pocket exposure is higher, especially with hospitalization and skilled nursing on a Medicare Advantage plan, cancer as well, we always recommend significant umbrella coverage, including hospital protection, because of those variable out-of-pocket costs. So again, fixed cost here is lower than a med sub typically. But don't assume just because the premium is zero that's advertised in your area that you should only expect to pay zero, because you are then exposing yourself to much higher out-of-pocket costs. When you choose a Medicare Advantage plan, much like we just went through our Part D process, we are going to look at your medications and make sure that you have your medications covered as best as possible. But also, we want to take a look at your doctors and hospital preferences in your zip code. Okay. The plans are specific to where you live, but no matter your age or gender, everybody pays the same for each individual plan. And then these plans may include some extras. Those extra benefits are not a reason to get a plan like this, but once we meet the plan selection with doctors and medications, the extras are just kind of a nice to have that may tip the scale one way or the other, depending on what's best for you. So, when to sign up for Medicare Advantage is going to be either at 65 initial enrollment or when you start Medicare Part B later. And then every year you can change that during annual enrollment. So not only actually annual enrollment from October 15th to December 7th, but if you start the year January 1st in a Medicare Advantage plan, you can also change from January 1st to March 31st. So there are a few different options to change these plans once you sign up for Medicare Advantage. So again, side by side, Medicare supplement, more provider choice, higher fixed costs, lower and more predictable out-of-pocket costs, less extra benefit. Medicare Advantage, lower fixed monthly cost, higher and more variable out-of-pocket cost, network-based care that has slightly more restriction than a Medicare supplement, also potentially referral, though not required, also more benefit rich as it includes your drug coverage typically along with other things Medicare does not cover. And finally, the review of the umbrella. So that Medicare plan with prescription coverage, that is your core product, whether it's supplement and a drug plan or a Medicare Advantage plan. So that is where we always start. And then it's making sure that, you understand with a Medicare, umbrella free coverage, we are covering all those major exposures that we talked about when it comes to cancer and dental and skilled nursing and home health care, things that are not always fully covered or not always approved by Medicare. So we will go through this with you one-on-one to make sure that you are getting the proper umbrella coverage that you feel fits your needs and your goals as you are transitioning to Medicare, whether that be now or you're working past 65 and we're helping you with this in 2 to 3, 5 years, whatever it may be. So with that said, that wraps up this Medicare segment. We hope you've appreciated it. Again, don't forget you can book an appointment with that calendar right there on the screen at a time that works for you with our team. No cost or obligation. Take whatever time you need, 5, 10, 20, 30 minutes to get questions answered and introduce you to next steps on what you should be considering for your situation.